one, going from discount thinking to value creation. Doctors have a thing with money. And I mean, I was there, I had the thing with money. And I think it is because we come from a place where we are taught to serve, where our hearts are to serve. And so we feel like we can't charge what we're worth. So in essence, what we do is we keep charging less, hoping to get more patients. And yes, then we do get more patients. But the truth is we don't become competitive then. We're selling on price, and those patients are generally our most difficult patients. Those are the patients that are not loyal patients. Those are the patients that shop around for price. So when you position yourself and you provide a value perception to a patient. Now, a value perception is when you add value to your service. So let's say in my practice, when the patient comes in, they are greeted by name, they have an amazing experience, they get a full skin analysis, they come in, they get their Botox, it's their treatment day. Instead of just giving them Botox, when they come in, they get a chemical peel before we start with their Botox. And it's just a quick chemical peel, we call it a flash peel, quick chemical peel, they get their Botox done. After I've done their Botox, and say it was just for Botox, we finish off by applying makeup for them. So we do it's just a tinted sunscreen, but we do their faces for them so that they leave feeling good about themselves, so that they leave feeling like they've had a $1 million experience. Their skins look great. They've just had their Botox, which hasn't kicked in, so that value proposition comes in with the immediate effect from the chemical peel, so they feel amazing immediately. They then get their Botox knowing that in 14 days from now they're going to feel even more amazing. And then on top of that, we let them leave looking beautiful, not like a bee stung them. And that is value creation. And so the next time that patient complains about price and she goes somewhere else, she'll realize quickly that when she goes somewhere else, she goes in, they ask her what she wants, she gets given what she wants, she leaves, no extra chemical peel, no Botox and extra care to that other than what she asked for, no post-care, looking beautiful and leaving there feeling like $1 million. So this is the difference between positioning yourself in price, where everybody competes, because then it becomes a price competitive thing, and realistically the value then lies with the person who provides the same value as you, but for a smaller amount than you. But if you position yourself as a value creator, then you can't compare with price, because now we're not comparing apples with apples, we're comparing apples with pears. So I want to know from you, are you pricing from a price point where you are feeling confident or where you are feeling fearful? And write that down for yourself. Then we need to make this swap. So since we're on the topic of money, we need to make this mindset swap from they can't afford it to it's not my job to judge. And a lot of the time we do that. A lot of the time we take and we project our fears, our beliefs, our money issues on other people, right? So it's not your job to decide what's expensive for somebody else. It's your job to offer a solution to that person. If somebody's coming in and they're complaining about their frowns, essentially they're not complaining about their frown. They're complaining about the fact that they look tired, feel tired, they don't feel their best, like they look their best. And so you need to understand on a deeper level what it is that they're after. Patients don't come in for injections. They come in for the outcome. They come in to feel good about themselves. They come in, they buy confidence, is essentially what's happening, right? So now, if the patient comes in and you have already decided this patient can't afford it, generally the conversation starts with, I know this is expensive, but, or I can't charge what I want to charge, so I'm going to just give this smaller amount. And then the patient will say yes. But when you do it in confidence, that patient, whether they buy now or later, that patient will feel confident about the fact that you've given them a solution to their actual problem, not to their frown lines. The frown line isn't the problem. The deeper problem is the fact that they want to feel beautiful, confident, look refreshed, whatever it may be. You giving them, offering them a range of solutions at a different price range, and they get to choose what they spend their money on. I can't tell you how many times in my life, in my Hilton practice, there's a lot of farming communities around us. And often patients have walked into our practice, and often I've thought, oh my word, this lady's never going to afford to do anything. She looks like she just fell out of the washing machine or out of the washing basket into the practice. And those are generally the patients when I give them the true solution to their problems that don't even blink when I give them the price. The pricing issue comes from us. And when you project that pricing issue onto the patient, they immediately feel that energy. They feel that undercurrent of this person isn't sure about what she's charging. So should I be sure about investing in her or in him? So it's very, very important that I want you to look at that. What are your money beliefs around affordability? Because if you don't believe that people can afford your services, you will never sell confidently to them. And then it will always translate into revenue that is not there, that should be there.